Hello, good morning, good afternoon, based on whichever time zone you're at. Thank you all for joining. We'll give it a couple of more minutes for more of them to join us. So during the webinar, if you have any questions, you can type it in the chat window. You would see it on the bottom right. There will be a chat window. Good morning. Thank you all for joining. We'll give it one more minute before we get started. Okay, I think we can get started. Again, good morning, good afternoon, based on whichever time zone you're at. I hope you're having a great week. So thank you all for joining. We had been covering a few topics on HIPAA. So there is a HIPAA series since the last few months on HIPAA BAA, Business Associate Agreements, HIPAA on risk management, proactive versus reactive. And today we'll be covering on HIPAA compliance through technology controls. We'll have a few more topics on the HIPAA. So the HIPAA series will be going over a few more months. So please stay tuned. And at any point, if you have any questions, you can add it in the chat window, and we will address the questions at the end of the session. Okay, so let's get started. So a brief overview of HealthDox. So we have been in the healthcare industry business for over 25 years now. We have been associated with Kansas Hospital Association. We are even endorsed by them. We have a compliance GRC solution suite with one suite covering multiple solutions. And we also have the AI pro packages and certified auditors and consultants if you're going through any ISO 9001 or any particular certification. In today's agenda, we'll be covering a few trends on the OCR enforcement side, their penalties and lessons learned from the enforcement actions, and also technology safeguards, right? What are the key HIPAA aligned controls, implementation updates, and the gap analysis. And the risk assessment status, any findings and remediation priorities. And on the compliance to tech execution, like mapping of the policy to the technology, closing compliance gaps, and driving operational readiness. And we'll have a few minutes at the end for questions and answers. So we'll go through a poll. The first one would be a poll. So basically, the first poll, let me launch. It's interactive, so go ahead. Has your organization conducted a technical risk assessment in the past 12 months? Okay, I see you being interactive. Thank you for responding. Okay, so it's about 50-50. So 50 are not sure, and then about 50% are saying yes. So you will know how important it is, and maybe you can take back the learnings to your organization when you're not sure about it, right? We can see how we can help also. So OCR enforcements. So let's take a quick look at the recent OCR trends in 2025. I'm sure all of you are aware of what OCR is, but a brief overview. The Office of Civil Rights, OCR, it's under the HHS and is responsible for enforcing HIPAA regulations. So over the past few years, OCR has ramped up the enforcement of efforts, and it's also focusing especially on the right of access violations. And it's also concentrating on any breach reporting failures. So breaches are actually okay a little bit, but if you're not reporting them, then it's a big deal. And if there is any lack of risk assessments, also they're targeting that. And the penalties are becoming more frequent and also a lot more expensive. So making proactive compliance is, taking care of proactive compliance is very essential. So in 2025, there were multiple healthcare organizations, as you see in these examples that we have provided here, that faced expensive HIPAA settlements, ranging all the way from 25,000 at a minimum, you see that, right, which is very high also, all the way going up to 800K. And this is due to inadequate risk analysis, either there are weak access controls, and some due to insufficient safeguards. So all these cases highlight that there is urgent need for stronger risk management and access enforcement and ransomware preparedness. So in our daily life also, right, we see constant ransomware attacks on our text messages and stuff that we get, and email especially. And our organizations do also send out those fake emails to see if we are falling prey to those spam messages. So the increased focus on technology-based safeguards for EPHI is being more of a focus. Also, there are high penalties for like weak access controls and missing audit logs and stuff like that. And breach detection delays, right, which is now a top enforcement trigger. And you see these examples are highlighting that. So OCR is checking if we have active use of safeguards and not just having the policies, but are we implementing and following them? And are we having any outdated or incomplete security tools that are flagging any investigations? So all that is so important. So that's why we wanted to highlight that before we go on to the actual topic of technical safeguards.
Thank you for setting up the context and also providing us a brief about 2025 OCR enforcement. That was a good beginning to start with the actual topic of the technical safeguards, which are not just the recommendations. If we are thinking this technical safeguards, whatever we are going to cover today are just recommendation, it's wrong. So they are not just the recommendation. Under 45 CFR 164.312, these are all the requirements. So the regulatory requirements which has to be met to demonstrate the HIPAA compliance. So let us first understand the technical safeguards, and then throughout this webinar I would be talking about these technical safeguards, and also followed by technical controls. Actually, what technical controls some organization are implementing to meet these requirements. So when we talk about this HIPAA technical safeguards, so we are referring to the technology measures which directly protect the EPHI. I'm pretty sure all of you who must be knowing what is this EPHI. It is nothing but electronic protected health information. So that has to be safeguarded. And these technical safeguards are the requirements to protect the EPHI. They are mandatory standards which are designed to secure from unauthorized access or even alteration or any during transmission any risk pertaining to these. So these all these things together we will cover under the technical safeguards as a mandatory requirements. Let us know what are the technical safeguards which is mandated by HIPAA compliance, HIPAA regulation under this CFR part. So the main thing is access control, and then audit control, security, authentication, and integrity. Let us understand these core components in today's webinar, all these 5 core components. Let us first talk about access control. So access control means making sure only the right people can access the right data, and only when it is necessary, not always. Okay. Audit controls are it is systems built-in ability which should be tracked, who access the information, when, and what actions they took when accessing the EPHI. That needs to be taken care in the audit controls. And integrity ensures that EPHI is not altered or destroyed in an unauthorized way. So authentication verifies that a person or entity is who they claim. Like, for example, if it is Dr. Jeff who is supposed to log into the system, then it has to, authentication should verify it is Dr. Jeff who has actually logged into the application. Okay, so before granting the access itself, the authentication should be verified. And the other thing is about security, the transmission security, which protects the EPHI as it moves across networks, because there will be a lot of networks among the hospitals, right? So when it moves across these networks, so the transmission security should protect the EPHI, guarding against the interception or even the tampering. So these 5 areas majorly called as the technical safeguard, which form the backbone of HIPAA technical requirements, and getting them right is very essential to both compliance and also the patient trust. Let's look at in detail about the access control and identity management. So both are about making sure the right people access the right data at the right time and only for the right reasons. That is very important. So only for the right reasons, the right people will access the right data at the right time. So how can we achieve this? So role-based across ensures staff only see the patient information they need for their job. For example, if a role-based access example could be a nurse. So nurse should see the charts related to their job, and billing staff should see the payment data. So that's how the role-based access ensures the required staff see the patient information only what is required to perform their job. And the other thing is about identity management. So identity management confirms every user who they are. Often we use the multi-factor authentication, right? Most of the organization, they have adopted this MFA, multi-factor authentication, as an identity management. So for example, if Dr. Jeff is logging, then it should be truly Dr. Jeff. So that's how it confirm the identity management helps us to confirm the login information. And many organizations use this technology controls as SSO, single sign-on, which actually helps reduce password fatigues, but still keep the access very secure. And privilege access is another thing which needs to be monitored. Privilege access logging means every action by high-level accounts also should be tracked, and which should give the accountability and quick detection of any suspicious activity. So that's how this component also becomes important under access control and identity management. So together with these technical controls, not only we protect the EPHI, but also make compliance easier and reduce risks from insider threats. So all these things like role-based access, identity management, SSO, and privilege access, all these forms as a controls, technology controls to meet this access control and identity management. Let's move on and understand other core technology safeguard, audit controls, and activity monitoring. So what is audit controls? Audit controls are about knowing who accessed it, what they have accessed, when they have accessed, and how. This becomes a core HIPAA safeguard when it comes to audit controls. So system audit logs record every access and action taken with ePHI. So we are throughout this webinar we'll be talking about HIPAA, so that's why I always keep referring the ePHI. So with system audit logs should also take an action, creating a digital trail for accountability. So how audit control works, it should collect the user activity logs, and every action should be time stamped, and record user ID and affected data when using the whenever it gets logged. Okay, so and also it should have alerts on anomalies like repeated failed login attempts or unusual access patterns, so that it allows quick response before a small issue becomes a breach. Okay, so how this can be achieved? Definitely some real-time monitoring tools we should be using. So that real-time monitoring tools helps organization move from reactive to proactive approach. That means spotting unusual activity as it happens, not later, after a month, after a week, not post. So it should be as it happens only. So that's how this real-time monitoring helps organization. And integrating audit logs with security information and event management tools, which in short we call it as SIEM tools, which makes monitoring very smarter by correlating data across systems. So these are all some industry used tools which is used for this real-time monitoring. So ultimately, these controls not only meet compliance, but also it builds the trust, right? So ensuring that patient's health information is protected, not only one time, it is all times, right? Let us talk about data encryption and transmission security.
Yes. So in encryption, it is one of the strongest shields, right, we have in protecting ePHI. So it ensures that even if the data is intercepted or stolen, it is unreadable without the right keys. So how do we enforce it, right? HIPAA requires us to secure data both at rest meaning when it is stored on the servers, laptops, or devices, and also during when it is in transit, meaning when it's being sent across the networks, on email, right? So think of it like sealing information in a lockbox, right? Only those with the right key can open it. So without encryption, there is sensitive health information that can be exposed in plain text. So encryption is like crypto. So something like that. So transmission security goes beyond just encryption. It also involves like secure protocols like TLS for like web traffic. TLS is like a transport layer security. So this is used for web traffic. You must be using VPNs for remote access and also secure messaging platforms for clinicians. This TLS enables and establishes a secure encrypted channel, so that is between two systems, like for example, between your browser and a website. So the TLS 1.2 and TLS 1.3 are the different versions of the transport layer security. The TLS, as it evolves, right, with the data breaches and stuff, these protocols also have to keep evolving. So with the 1.3, it has a lot more secure features, and this protocol helps with the securing of the communication over the internet, like using of HTTPS. So when you're looking for a website security, right, you see if there is an S at the end, which is for security. and then using emails, VPNs, etc. And there are real world incidents have shown that breaches often happen because emails or data transfers were sent unencrypted. So making them easy targets to these preys. So by enforcing that encryption policies and automatic email scanning and secure channels, we see that organizations can not only stay compliant with HIPAA, but also reduce the risk of having expensive breaches and then patient trust loss. And then, yeah, it involves like the brand reputation is impacted, right, of your organization itself. So we saw that OCR enforcements all highlight to these issues, right? And taking care of the next one, which is the integrity controls and data validation is the next one. So making sure that electronic health data isn't altered or tampered with, like either accidentally or maliciously. So HIPAA risk requires like organizations to put mechanisms in place so that the ePHI stays accurate, consistent, and also trustworthy throughout its life cycle, right? Life cycle meaning like when it is during the transit mode, or is it in the in rest mode where it is stored. Just like you had file cabinets, you had to store all those data before you had all these automated policy management systems, or you are even now transferring policies across through emails and stuff, and it could randomly end up in someone else's hands. So protecting all these and the data validation helps check and prevents errors also. For example, it stops incomplete forms from transmitting, flags incorrect data entry, and also catches any mismatched patient IDs before they cause any bigger issues. So incorrect patient ID would cause another patient's data in someone else's hands, right? So think of it as a system that is constantly asking, is this data still complete? Is it accurate? Is it valid? So we need to question ourselves, and our systems should be in place so that these are automatically handled by the system. And integrity monitoring tools can track whether there is unauthorized changes, whether there is visibility into what data was modified and by whom. So this isn't just about compliance, it's about clinical safety. So it's imagine like you have lab results being altered, or medication orders having errors or being shifted. So validation controls catch all these risks earlier. And by combining these integrity checks with these validation rules, organizations reduce medical errors. They also protect against fraud and improve any audit readiness that need to happen. So next, let's go through the next poll. So let me launch. Okay, which area of HIPAA technical compliance do you find most challenging? Is it access controls? Is it audit controls, data encryption, or secure transmission of data? Okay, I see almost everyone voted for audit controls. Awesome. Yeah, I should have had all of the above too, right? Like everything is important, but audit controls would catch all of these issues. So yes, automatic log off is the next topic.
Yeah, thank you. Yeah, thank you for taking up this poll. I see 100% has voted for audit controls as most challenging. Okay, let's address that also. Can you move on to next slide, please? Thank you. Okay, so let us recap on what we have seen under technology safeguard. So mainly the access control, audit controls, security, authentication, and integrity. So these are all the technical safeguards which form the four core component to meet the HIPAA requirements, technical requirements. So now let us understand the technical controls. So what is the difference between technology safeguards and technology controls? The difference is very minimum. Technology safeguards are the standard driven requirements like HIPAA regulation as laid out. These are these as a technology safeguard as the requirement. When I say technology controls, that is the way organization is going to use the technology to achieve these requirements or meet these requirements. That's a little difference between the when I say technology safeguard and technology control. Okay, so let us focus on, though it is very simple, but it is more powerful, is the automatic log off and session management. Let us understand how this automatic log off and session management works as the technical controls to meet this access control. So though it sounds simple, right, when we say automatic log off, but it is very effective safeguard. How? Because it prevents unauthorized access when even a user is not present in front of the system, or when a user forgets to log out. Then also it makes sure unauthorized access risk is mitigated, right? Because that's the main reason why we always say automatic log off needs to be set it up, right? So otherwise, just imagine a nurse leaves the workstation open in a busy ward. Imagine what could happen, right? So without having an auto log off feature, definitely the EPHI will be exposed. To avoid this or to mitigate this risk, so the effective safeguard and the control is automatic log off. Set up the automatic log off for all the users in the organization so that it prevents an unauthorized access. Okay. Then what is session management? So session management is the one which ensures that access is tied to a defined time or defined activity, which reduce the risk of abandoned sessions being misused. Like if the session is supposed to be for 30 minutes, it should not go for 5 hours session, right? So we can avoid having the session management controls in place so that the session will not get misused. So HIPAA expects organizations to implement these controls as part of protecting EPHI, especially when we are in the shared environments like hospitals, right? So beyond compliance, it's all about minimizing the human error by using automatic log off and session management. So technology is acting here as a safety net when the staffs are busy, right? So together, auto log off and session management, I would say, which reduces the insider threats and which also strengthen the security and give auditors a confidence that systems are well managed. See, audit control, you were saying it's challenging, right? So there also it gives the auditor a confidence by following this automatic log off and session management practices. It gives them a confidence, okay, yeah, these systems are well managed. Okay, so let us understand the risk assessments and continuous monitoring. So another aspects, I think all of us will agree to this, the technical safeguard is risk assessments. So always when we talk about risk assessment, I always use the term as a proactive. See, whatever we do as a risk management, it is not sufficient if we just do it with a regular risk assessment. No, it won't help you in that way. So HIPAA requires not only regular risk assessment, but take a step further with continuous monitoring. So that is the key aspects of risk assessment in technical safeguard. So this means we are not waiting for an annual review to spot the vulnerabilities, right? You agree with me? So our systems are constantly scanning for the risk in real time. So when this happens, then only it becomes a proactive risk assessment. Otherwise, if you just wait for an annual review to happen on all the assets and find out the vulnerabilities, then it is of no use. You are not doing an effective risk management. So this is the one of the key safeguard, technical safeguard through which we can achieve the HIPAA compliance. So this includes monitoring of for an outdated software, misconfigurations, and even access anomalies, right? So not only just doing the HIPAA risk assessment on paper, but we also should have some continuous monitoring mechanisms to monitor an outdated software or access anomalies or misconfigurations. Okay, the combination of these formal risk assessments and also ongoing monitoring, both should be there. I cannot say just do the continuous monitoring and don't do the formal risk assessment. No, you should do both. Do both formal risk assessment and also continuous monitoring. With both hand in hand only, we can help you achieve the results. So that we always aware of our risk posture by doing both the formal risk assessment and ongoing monitoring. And that's why we can immediately remediate issues even before they become compliance violations or compliance gaps. So risk assessment and automatic log off are two components under technology controls, and another important component is the incident response and breach detection tools. These are all controls. So even with strong controls, I don't say that incident will not happen. Incident will happen. It can happen, but you should have a controls in place so quickly detection and response are critical under the HIPAA incident monitoring. So incident response tools help spot unusual activities which contains threats and limit damage before data is exposed. So our objective is simple: detect and respond to security incidents promptly. Okay. So modern tools like, as I was mentioning even in my before previous slides also, the SIEM tools, integration and automation, and even AI provide real-time alerts so teams can act immediately. So breach detection tools looks for red flags like suspicious logins or unusual data transfers or failed access attempts. And what is key in incident response is a documented incident response plan, which is not a best practice, but it is required by HIPAA. It is a mandatory requirement from HIPAA. So you should always have a document incident response plan. So defining who acts, what steps to take, and how to notify, all those things to be documented as part of an incident response plan. Okay. So the goal is mainly to quickly answer what happened, who was affected, and how was it contained. So strong, I would say, the key takeaway from this incident response and breach detection tools is the strong detection and response shift organization from reactive to proactive. When I say reactive to proactive, definitely it reduces both breach impact and OCR penalties, what we were seeing in the beginning slides, right? So there are many detection tools available, like we call it as IDS, in intrastation detection systems, data loss prevention, that is DLP, alert escalation workflows will be there, forensic tools for post breach analysis. Those are some of the tools available to do this incident response and breach detection. And let's understand aligning how this alignment of IT controls with organization policies. And this becomes a key when I say aligning IT controls with organization policies. This is one of the control, actually, technology controls, because the technology controls are only as strong as the policies they support. That's why I say always policies are also key, like any technical controls. We always align safeguard like even access control, encryption, and logging with HIPAA policies and procedures. We always align these two together. One is the technical controls, another one is the HIPAA policies and procedures should be aligned. Then only this way staff can understand not just how to use those technical controls, but why those technical controls are exist. When the staff can understand why these exist, then only it can be implemented promptly by the staff, right? So the key is every safeguard must tie back to a written policy. That is a must. For example, if your policy requires, let's say, MFA, that is multi-factor authentication for privileged accounts. So how do you know that this is MFA is required for privileged accounts? That your system must enforce it by tying with the organization policies for privileged accounts. And also audit logs must confirm this. Okay, yeah, this privileged accounts are getting logged in using a MFA. That is what gets done with the provided as evidence for the audits with audit logs. So this makes controls not only functional but makes it auditable. So for everything, if you start maintaining that records when you implement a controls and tying with your organization policies, then it is easily auditable. So it makes your audit controls easy and makes the audit program smoother. So when IT controls and policies are aligned, I would say the audit becomes very smoother and the compliance gaps definitely will shrink, and staff actions always stay consistent because they have understood why these controls are exist and how to use it and why they are using it. So their actions becomes consistent with both regulations and the system configurations, right? So it also improves in a way the training, because the rules staff see in policy matches the rules they encounter in practice. Both goes hand in hand, right? Whatever is defined in the policy, they are seeing in the practice and also making sure that practice is met by them, right? So in short, think of policies as the skeleton and IT controls as the muscle. Only when both work in sync, then your HIPAA compliance program stands strong. So the key is always align your IT controls with organizational policies. This is, by the way, this is not just a best practice, but this is a requirement by HIPAA regulations.
So let's look at a real world example. So here is a case study where a regional healthcare provider, they had faced multiple audit findings related to, say, data access, breach detection, and encryption gaps. So basically almost every issue. So they handled it by implementing layered technology controls. So it ranged from like advanced encryption. They automated the integrity checks to AI-driven breach detection, and the organization not only closed the current gaps, but also reduced their incident response time from 72 hours to under 4 hours. So this transformation moved them from a reactive risk posture to a totally proactive, resilient compliance framework. So this actually aligned perfectly with the HIPAA's technical safeguards. So they took it to heart and implemented so that they don't run into a similar issue in future. So let's take a quick poll. That would be the last poll. So what would be the most valuable? What would be most valuable in strengthening your HIPAA compliance program? So is it automated monitoring tools, staff training on technical safeguards, or is it regular risk assessment? Okay, so that's good. 100% say that it's regular risk assessments. That's good.
Yeah, that's good. That indicates from reactive to proactiveness.
Very good. Good job. So let's go through some solutions that will help you through this process, right? So if you have like a contract management system, so many HIPAA compliance gaps start with vendor agreements and business associate agreements. So our solution actually centralizes all contracts, adds auto renewal alerts, and tracks the HIPAA safeguard clauses. So this means that we prevent contract lapses that could weaken security controls, and it also ensures that vendor compliance stays aligned with the HIPAA technical safeguards. So if also you have a solution that takes care of the policy management, policies are only effective if they're accessible, traceable, trackable, and enforced. So we provide a centralized repository with version control and access logging, restrictions, and also instant policy distribution. So this ensures that the policies are embedded in their daily operations, into the daily operations, and not just stored in a binder or PDF that nobody sees. So the next one is HIPAA risk management, right? Where their HIPAA requires ongoing risk management, risk analysis, and not just an annual checklist. So our platform uses a dynamic risk register and vulnerability scoring and mitigation tracking. So this supports continuous assessment of technical safeguards and also closes gaps before OCR finds them. So it is us and the team that we are involved with should be doing these findings. And HIPAA audit management, right? OCR audits are stressful. So if documentations are scattered everywhere, so our centralized audit management keeps readiness and compliance in check. So it supports evidence tracking and also the OCR aligned response packs all are in one place. So this reduces any last minute scramble when you have an auditor. So you don't have to be waiting for an audit to happen, but you can be always audit ready. And whenever you are ready, we have in future when you have AI and you're ready to embrace AI, it's just coming fast, which I also don't like the speed at which AI is hitting us. But when you're ready, we have solutions and pro packages in place that will shift the compliance from reactive to predictive. It helps through risk analysis, predictions, and all that also. So a brief minute on our GRC suite. We have multiple solutions all in one place, like quality management, where we have the proactive assessments, and if there is any particular performance trigger, it triggers those solutions and it triggers those incidents automatically when there is any control chart violation, limits violations, and so on. So we have the contracts, policy, compliance, and they all talk to each other. So since it's all stored in a single database, you can have reports, a combination of reports from compliance to policy, and also within the compliance management, you have access to policies. So say you have different vendors, then they really don't talk to each other. And when you are going to be having any AI models, it is best when everything talks to each other, because AI is looking at all these data. And so risk management is not just an isolated risk management solution, but it looks at what kind of policies you have, are there any compliance gaps, and so on. So we are at the end of our time slot. So if you have any questions, and if you have one more minute, I have a question online which I can briefly call out. Otherwise, here are our contact information, and you can reach us here through any of these means. And a quick question is, how can AI help healthcare organizations in the HIPAA compliance through technology controls? The answer is AI helps healthcare through organizations by maintaining HIPAA compliance, by securing the access, monitoring activity, because it's on the go, right? A 24-hour surveillance is happening, and through protective PHI, through intelligent encryption, anomaly detection is happening. So these quality control modules that we are talking about, they have 24/7 vigilance, where if there is any risk analysis or anything that pops out, it will record it as an incident that you can view the next morning and take care of how to handle that incident. This is how the response, it also helps you with the corrective action plans and coming up with some suggestions and stuff. So that's how the incident response can reduce from the 72 hours to 4 hours through AI. It will help you and guide you through the process. So I would like to thank all of you for joining us, and please stay tuned. We have a few more topics that will be coming up soon in the next couple of months. We'll be continuing the HIPAA series, and also we have a calendar link that you can take a look at, so we can go through. If you have any questions, you can connect us through any of these means, and I can set up a 30-minute session with you. Thank you all. Nice meeting you, and looking forward to you in the next session. Take care.
Thank you.
Bye-bye.
Great day.
Thank you. Bye-bye.